Hello, good to have you join us. This is Platform. I'm Ruth Aguela. A nation that takes good health into cognizance is undoubtedly harnessing the greatest assets of its population. Like they say, health is wealth. For Nigeria, with different health challenges, now improving the quality of health services becomes imperative. As part of efforts towards actualizing the universal health coverage and prioritizing the well-being of Nigerians, one of the initiatives of the present administration was the launch of the Health Sector Renewal Compact between the federal government, the 36 states, and development partners. The goal is geared towards saving lives, reducing burden posed by health challenges, improve population health outcomes, accountability, affordability, and accessibility of health services for all Nigerians, which is part of the Renewed Hope Agenda drive. Well, citizens have great hopes and expectations for the health sector, and there is an increased urgency for a well-functioning health system. And achieving the universal health coverage, experts say, will require strengthening health systems across the board, tackling infrastructural issues to revamp the health sector to improve high-quality services to Nigerians. On Platform, the spotlight is on assessing the health sector initiatives under the Tinubu administration. And our guest is Dr. Aminu Magashi Garba. He's a health expert and CEO, Africa Health Budget Network. Thank you very much for joining us, Dr. Garba.
Thank you very much, and I'm glad to be here.
Good to have you here. So let's let you in on who our guest is. Dr. Aminu Magashi Garba has over 25 years experience in health development work. He is the founder and coordinator of the Africa Health Budget Network that uses budget advocacy to influence adequate and efficient health spending and improved transparency and accountability in Africa. He is the global co-convener of the Community of Practitioners on Accountability and Social Action in Health and currently hosting its global secretariat in Abuja. He is a member of the Global Action Plan for SDG Goal 3, Civil Society Advisory Group, and a former civil society representative to the Global Financing Facility, Investors Group. He is on the board of champions of the Partnership for Maternal, Newborn and Child Health hosted by WHO, that was in Geneva. He is a member of the FP 2030 Accountability Advisory Group in Nigeria. He chairs the Leadership, Partnership and Coordination Committee of Nigeria's National Multi-Stakeholder Partnership Coordination Platform. Well done, Dr. Garba.
Thank you.
All right, our panelist is one of our health correspondent, Basi Ita Ipang. Thank you for joining us on Platform. And this is your first time on Platform, right?
Yes, of course.
Oh, it's so glad to have you join us.
Thank you very much.
She's actually the FCT chairperson for NAWUJ, so we're proud to have her. Thank you.
Thank you for
All
having
right.
NAWUJ here.
We're discussing health matters now,
Yes.
not NAWUJ.
No problem.
So, Dr. Garba, we're not leaving you out. It's not a women affair.
Okay.
But you know, when we're talking health issues, a lot of women are always, affected.
Sure.
But let's look at the broader picture. When this administration came on board, health, of course, improving health and prioritizing the well-being of Nigerians when it comes to health, it's part of the Renewed Hope Agenda. Now, if you want to give an assessment, we saw the launch of the Health Sector Renewal Compact Initiative, which you're also a part of.
Yes.
And you are part of the advisory, the
advisory
state
group.
Advisory Working Group. So
Yes.
tell us, from a private sector perspective, how would you assess the health initiatives?
Okay, so thank you very much for this question. And it is good to be here to look at the journey over the last 12 months in Nigeria. We need to understand the health sector renewal and investment initiative, which is part of the overall administration agenda. So there are 4 components of the health sector renewal program, and it's good to comment on each one of the 4 depending on the time. the four components of the health sector renewal program is one, effective governance, improvement governance of the entire health sector. And in improving the governance, there are certain things that the government plan to do is to strengthen accountability and transparency in the way we manage our resources in the health sector. And I'm sure you also remember in 2014, Nigerian government signed into law what is called the National Health Act. And within that Health Act, we have the basic healthcare provision fund. So we need to ensure that that fund is being managed in accountable and efficient and transparent manner. So that is the governance. And we also need to have a coordinated structure, linking the federal government with the state government, with the local government, to strengthen the governance communication, how minister engages with the commissioners of health, and how the commissioners also engages with the local government. That's one bucket of the health sector renewal program. The second bucket of that is to ensure effective and efficient quality of care. What happened at the facility? Strengthening the primary health care, health promotion, like what the media does, raising awareness, educating people in the health sector, ensuring that the primary health care is working very well at optimal level everywhere in the country, not only Abuja, where we are, but everywhere. That is the second bucket. Now the third bucket is to unlock the value chain. You are aware that generally in Africa, we are importing drugs and vaccines. This is not, is already known by everybody.
Yeah.
So unlocking the value chain of the renewal program of the health sector is to encourage and stimulate local production of essential drugs for our people.
We'll get to that aspect of, looking at how this compact initiative will help, because it's encompassing.
Yes.
How local manufacturers, can, their capacity can be improved to boost production. Let's have Basi come in now.
I want to ask Doctor, when you're talking about unlocking the value chain in the health sector, could you just let us know how much of the value chain has been unlocked?
So
the impact it has created on the common man in the village.
Yeah, so I think over the last 12 months, the coordinating minister, in collaboration with multiple stakeholders, including development partners, including NGOs like us, including the private sector, has created an initiative to unlock the value chain. What does it mean? It's to encourage local production. I'm sure you're aware that in many of our states in Nigeria, there are a lot of pharmaceutical companies locally registered in Nigeria. So what it means unlocking the value chain is that we need to encourage those our local pharmaceutical companies and industry to get adequate local funding and support so that we can begin to manufacture some of our basic essential drugs in Nigeria. And that will reduce the burden of health in Nigeria. You are aware that importing drugs is costly, and a lot of people could not afford to buy drugs. When you go to the market, when you're buying a branded Ampiclox, you need to put over 10,000. When you're buying another drugs, antibiotics, so these are very expensive. So if we encourage our local manufacturers, but we need to also encourage them by giving them support. So it's not only about just telling them to go ahead. We need to encourage them if there's any maybe soft loan from the Central Bank of Nigeria, from our our banks, and if there's any support from our philanthropy. So we need to encourage them not only in Abuja but everywhere in Nigeria, so that we can begin to manufacture our drugs locally, and that will reduce the cost of the drugs and also the cost of care.
I think, Doctor, that is encouraged, because looking around with what is happening now, most of our pharmaceutical companies are leaving the country. So if we could encourage, the production of our indigenous drugs and the way it should be, because I know that is the problem. Most times the minister talks about
Yes.
having them to produce their drugs and the way it should be, the standard that is needed.
That is true.
Okay, and part of the goal is to have access, talking about Nigerians having access to quality health services. And it's good you're hitting on the aspect of locally manufactured drugs, which, like she mentioned, pharmaceutical companies where, you know, there was an outcry last year that they want to leave the country because of lack of, you know, the raw materials.
Yes.
Now, part of the ways, you know, that can be addressed, experts have come out to say research, you know, and production.
Yes.
Now, you are part of this initiative. In what ways, you know, can we build that capacity for Nigeria? You talked about importation of vaccines, which was seen. COVID-19 was an eye-opener. You know, we're still lagging behind.
Yeah.
Now, how can the nation, you know, boost its capacity for research and to trickle down to production?
Yes. So one of the easy way is that research should not be for research. It should be, you know, research for intervention.
Yes.
Operational research that will spur up development. You are aware that Nigeria has so many universities. In everywhere, you go to every state in Nigeria, there are universities. That's the academia. We need to bring them closer to the health sector. So
more like a synergy.
Very good.
Okay.
The academia, they do a lot of research every year. So to what extent are we communicating the findings of that research into the policy space and the political actors? So that is a missing link that we need to bridge. If we can encourage our universities, they are very hardworking. You see a lot of researchers. All they require is very small support, and they will do great things.
You've been mentioning support. Break it down. What kind of support?
Yeah. Okay. So if we are talking about research and development, when you go to university and you want them to do a quality research, we need to allow them to have access to funding. Because they need to buy some raw material, they need to buy reagent, they need to have electricity, they need to have water, they need to have a very secured environment to do a research. So that means they require support. They also need to have an enabling environment. That is, they need to know that if they do research, there's also another sector of the government that's willing to take the research to improve policy and programming. So that means we need to ensure a conversation between the academia and the Federal Ministry of Health and 36 states ministry in Nigeria. That conversation needs to be strengthened and need to be happening regularly. They need to come to our meetings within the government and civil society, space to make a presentation of the research finding. So it's not only about publication. Publication is always good. It's a great idea for them to publish, but we need to turn that publication into real, tangible action in Nigeria health sector. The findings to become useful, to be implementable, and also at the same time to, as we mentioned, unlock the value chain. That is encouraging local production, evidenced by research. Vaccine production, evidenced by research. And also, if we are going to test an innovation, at a particular state, is also backed by a research from the academia. That is what needs to be done in the country to support academia to do research.
Okay, Doctor. Now that we're talking about funding and the rest, one aspect that the present administration is being commended and appraised is the area of investment, increased investment and budget allocation to 1.58 trillion from what it used to be. So what would you say about this?
Okay, so I'm sure you're aware that the economy is also shrinking. Of course, we have 1.3 trillion naira health sector budget, the biggest in the history of Nigeria in terms of the figures. 1.3 trillion.
1.23
trillion.
Okay.
That is the biggest we ever have. But when you look at now the value of that money, because of you're aware of the dollar and the naira, the foreign exchange. So when you look at the actual figure of that money, we're looking at about 750 billion naira in terms of real value of that money. But it's still very good.
Yeah.
Even though it's in real value, it's not up to 1 trillion naira. Now, but within the budget, we also need to look at what is inside the budget. So, let me give you an example. What is inside the budget? Within that budget, Nigerian government allocated about 137 billion naira for immunization, for vaccines, and also for us to match counterpart funding. You are aware Nigeria has signed a lot of partnership with the Global Fund, for tuberculosis, for malaria, for HIV. So that money is to address the counterpart funding. Now we have about 125 billion naira for the basic healthcare provision fund. That is the primary healthcare of the compact you mentioned. How do we support the primary healthcare to function? Basic things. Ensure that every pregnant woman, she goes to antenatal care at least 4 times. Ensure that every child is fully immunized. Ensure that women, when they are pregnant during labor, they are attended by a skilled birth attendant. Ensure that our water system in the facility is running. That's the primary health care.
Yeah.
If there's any problem in the community, if there's any complication, there's an outreach program to address that issue. So this is part of the funding, for the health sector. Then the remaining money is going for our tertiary, facilities, our teaching hospital, our federal medical centers, and also don't forget we have the Nigeria Center for Disease Control, the NCDC, which is helping us to address detecting and preventing outbreak of diseases. That is the 4th bucket of the agenda. How do we improve our health security? So we have the National Primary Healthcare Development Agency, we have the Nigeria Center for Disease Control, and we have so many other agencies supporting Nigerian government to respond to emergencies like the COVID you mentioned, Lassa fever, meningitis, and so many other outbreaks of disease. We need to have enough funding, enough manpower, enough skilled, personnel that they can do surveillance and detect any infection in Nigeria to address those kind of problems.
And the commitment we get to hear from the minister, the coordinating minister of health and social welfare, like what you're saying, to channel $3 billion, dollars into the primary health care, having to bring the number of functional primary health care from 8,000 to 17,000. That is cost intensive.
Yes.
Now, Nigeria alone, the burden, in as much as it is highly commendable that this administration thought it's needful to improve the budget, there's also the aspect of having investors, invest in the health sector.
Yes.
How can Nigeria leverage or position itself for such opportunities? We get to see the investment coming, but what critical areas should that be channeled to?
So I think the biggest challenge is to see that the investors are being guided properly.
Yes.
Yeah, but I also agree with you that we need to put more money for the primary health care.
Yes.
Because if we are going to elevate the 7,000, PSCs, we're adding about 9,000, we're adding about 10,000 PSC across Nigeria, we have to do more. Many of those, primary health care facilities, when you go, they need to be upgraded. They need to have infrastructure, they need to have water running, they need to have a solar, cold chain to manage our vaccine. They need to have enough
storage facilities for
exactly.
that.
They need to have enough nurses, midwives, lab technicians, medical doctors. So that means we need to put more investment into the primary health care. But I think the good news is that the international development community, they have responded to Nigeria's health sector challenge. They are willing to invest in Nigeria. About 2-3 weeks ago, there was a summit in Abuja to engage a lot of foreign investors in Nigeria, and a lot of
just to come in here,
promising.
Dr. Garba, this is not the first time we hear, okay, international development partners are willing. There's always that willingness,
Yes.
but commitment, to direct investment is another critical aspect we should, look out for.
Yes.
If you want to assess the present administration in terms of commitment by development partners, international development partners, what will you pin it to?
So, I think so far so good. My understanding, I can give you some example of already some investment,
Okay.
in the health sector. The Global Fund, for tuberculosis, malaria, and HIV/AIDS has already, committed almost $1 billion naira. Sorry, $1 billion dollars, not naira, $1 billion, almost about 900 plus, 50 thereabout. That's huge investment. If we can make use of that resources in Nigeria, that will go a long way to reverse and the trend of malaria problem, tuberculosis, and HIV. We have the US government, the UK government under different mechanism. They are also supporting Nigerian government through the health sector. Don't forget they also have the United Nations agencies, the WHO, UNICEF, United Nations Population Fund, United Nations Women, United Nations Development Program. They are also available, supporting Nigeria, not only with money, but also technical assistance to also address our problem. And also we have other, relevant partners like the World Bank, putting a lot of resources, not only the loan, there's also the global financing, facility that you mentioned in your brief. They are also supporting Nigeria. We have the pandemic fund. It's a recent global mechanism we call the pandemic fund. This is also another mechanism to support countries to respond to epidemics and also pandemics, like the Lassa fever I mentioned, the meningitis, Ebola, COVID, any kind of, epidemic or pandemic. That pandemic fund is set up to address and provide, funding. And Nigeria has already keyed into that pandemic fund. About 2 weeks ago, a meeting was convened, and Nigeria was writing proposal on how to access that funding. We also have the Global Alliance, for Vaccine, Gavi. Recently also there's a lot of series of conversation what we call the full portfolio planning, under the Gavi. And the Gavi is also committing over $200 million to support Nigeria address immunization problem. That means there's funding everywhere. we need to be organized to access and manage the funding
management.
Okay, Doctor, you've talked about all these commitments and funding and whatever. Have we thought about the sustenance? The sustenance is another part of it.
That is true.
Have we thought about the sustenance? The fundings are coming. The commitments are coming.
Yes.
How prepared are we?
So if I take an example of the Gavi, that is the alliance, the global alliance supporting Nigeria on immunization and vaccine. So it is a partnership, what you call a 10-year partnership between the Nigerian government and the Gavi alliance.
Okay.
And what it means is that every year Gavi will commit funding, and Nigerian government will also allocate money in the budget, for immunization. So every year, as Gavi is reducing commitment, Nigerian government is adding commitment, and they'll be around to provide technical assistance and guidance. And we, the CSOs in Nigeria, we are also, players to monitor, to review, and also to provide feedback where we see gap or challenges to improve the system. So I like the partners right now. They are encouraging that kind of partnership. We have the partnership between the Nigerian government and so many other, foreign investors in Nigeria. They provide technical assistance. They also provide funding. And also, we are making effort within the Nigerian government to what you call an earmark taxation. That is, we look at our own taxation and say, okay, can we take some money and commit for the health sector? That's what you call, you are not increasing the tax. We are just earmarking tax and say, okay, let this tax from, let's say, industries, from value-added tax, from telecom tax, can we put small money into the health sector? So the sustenance could be there. But the biggest sustenance is effective utilization.
But let's also look at infrastructural gap, which is a very big challenge for Nigeria. Yes, there are interventions for vaccines and other diseases, so to say, but infrastructural, talking about having the right equipment, the right facilities at the strategic places. We don't even want to go to our primary healthcare centers. Let's hope that, this initiative will change the narrative. Infrastructural gap has been a challenge.
Yes.
Dr. Garba, how can, this funding that we're talking about be channeled into that aspect? This is a long, this is a burden that has been on the shoulders of the country for a long time.
Yes. So one of the ways that, like I said, the biggest investment we need to have in sustainability is to ensure that there's effective utilization of whatever resources that we are getting from the donor partners. But also locally in Nigeria, we need to create our own, what you call, trust fund, sustainable trust fund in Nigeria that would be matching with any funding we're going to get from outside. So let me give you an example.
Okay.
There's a lot of effort to create a local HIV/AIDS trust fund, so that as all these donor funding are graduating out of Nigeria, we'll have a kind of a pot of funding that we can address all the gaps of HIV/AIDS. Many states are establishing healthcare trust fund. And how do they mobilize money? They mobilize money from, for example, I know like 2-3 states in Nigeria that set off the healthcare trust fund. Now what they're doing, they say 5% from all the money they mobilize from the revenue, within the state. So 5% is allocated to that, trust fund. That's sustainable. But this is local revenue, from taxation, from what you are gathering. So 5% will go into the healthcare trust fund. Then they will also commit 1% of the local government allocation for that state. 1%. So you can imagine, it's just small money, but when you gather all the local government in a particular state, 1% of the money, that's huge every month. So when you have the 1% for local government, you have 5% from the revenue, local revenue from a state, you have a sustainable funding. So this is what we are encouraging, every state in Nigeria to establish a trust fund that will address the issue of sickle cell, cancer, cancer of the blood, and so many other, childhood illnesses, including all the, challenges of health insurance. I'm sure you're aware that our insurance coverage in Nigeria, is still below about 20 million Nigerians. We are grappling below 20 million Nigerians. They are on a regular health insurance coverage. So this kind of trust fund will give us expanded access to insurance coverage, and our target is that we're looking at over the next 2 years, based on the health sector reform agenda, over 80 million Nigerians, they need to be on the health insurance scheme.
I was just going to say that the insurance coverage is another issue.
Yes.
Because a lot of Nigerians are left out. But that's an issue we'll pick up after this break. Let's take a break.
That means that one training workshop is not enough.
All right, good to have you there. The conversation is assessing the health sector initiative under the Tinubu administration. Dr. Garba, just before we took that break, you were talking about the insurance coverage.
Yes.
We're going to delve into that. A lot of Nigerians are not even aware, that it is their right to be part of this coverage. Basi, you want to pick up from there?
He was also talking about the establishing a trust fund.
Yes.
He mentioned of HIV trust fund.
Yeah.
And I remember that last year, if I'm correct, the federal government launched HIV trust fund.
Yes.
So how is that trust fund faring?
Okay, so the
So we're asking you two
Yeah.
in one.
the HIV trust fund is slightly different from this healthcare trust fund that I mentioned.
Yeah, okay.
The healthcare trust fund is an initiative of the government, and also money from local revenue from states and also from local government. Now the HIV/AIDS trust fund that was launched, as I mentioned, was a privately led trust fund, but with the backing of the government. So that's the difference. So a lot of billionaires in Nigeria, bankers, business community, they join hands together and establish the HIV/AIDS trust fund. It's still there.
So how has that impacted on the life of the people? Because I know Nigeria is still placed second
Yes.
when it comes to HIV and AIDS indices.
Yeah, so more need to be done. When I say a privately led trust fund, it means it's not binding on the private sector to put money. There is no law or legislation that is backing the HIV/AIDS trust fund. It means for us to make it better, we need to back it by a law.
Okay.
So it becomes a compulsory contribution, from the government or from anywhere that we're going to agree to achieve that. The healthcare trust fund that I mentioned at the state level, they are all backed by law. So it makes it mandatory for the government to commit 5% of the total IGR of the state into the healthcare trust fund, then 1% allocation of local government, subvention every month. So we need to have that kind of issue. For example, also the basic healthcare provision fund at the federal level is also another health trust fund. Now that one is 1% of the total consolidated revenue of Nigeria every year is going to be allocated to the basic healthcare provision fund. So
what about
1%.
the insurance health coverage?
Very good.
Yeah.
So the insurance health coverage, the good news
a lot of people want to be part of that.
The good news is that Nigeria has signed a new law in 2022. It's called the National Health Insurance Authority Law, which replaced the previous National Health Insurance Scheme. Now, this law has made insurance mandatory and compulsory on every Nigerian is supposed to be covered by the insurance. But in order for us to make it mandatory, we need to raise more money. Because if there's no funding, then it's
where's the coverage happening?
Cannot cover. So we need to raise more money.
Sure.
So a lot of effort to have a vulnerable, people's fund within the insurance scheme. Money to be moved from earmark taxation. You are aware of the sugar tax. So all the effort to put more money into the health sector. The basic healthcare provision fund is 1% of the total CRF of Nigeria, and that 1% in 2024 it amounted to 125 billion naira, and 50% of that money is supposed to go to the insurance authority to cover insurance for ordinary.
Okay, Dr. Garba, hold it. You're just calling figures. Let's get it clear for the Nigerian out there who wants to understand how am I being impacted.
Yes.
Now, how can you break it down? For that. Yes, it was signed as the NHIA now, but how many people are aware that it is their right and it is mandatory?
Yes.
That's the goal. People, when it's not having impact, right?
Yeah. Let me even add to that. I know also that plans are on the way for non-civil servants to be covered in the scheme. So, as to answer what Ruth is asking you now, can you explain to people how they could key into this?
Yeah.
Because some of them don't know, just like Ruth is saying.
That is true. So, if you are aware, the National Health Insurance Authority, the biggest chunk of money that is going to the NHIA is through the civil servants. Money is being mobilized every month, and allocated to the authority to provide services to all, federal institutions where civil servants are working. Then at the state level, you have the state insurance scheme. There's also covering the civil servant at the state level. So, but if we add all this in, we are talking about below 20 million Nigerian population being covered by the insurance scheme. And we have 200 million Nigeria.
Yeah.
So that we should do more. And the way to do more is to expand the investment into the insurance. That means we need to push more money from other sources apart from the civil servant. We need to get some earmark taxation. We need to get the sugar tax. We need to get the vulnerable fund through the basic healthcare provision fund, money from the healthcare trust fund at the state level, community philanthropy, the private sector contributing, civil society organizing, people under a community and say, we're going to help you to mobilize some money from you to now pay for the insurance. So these are some of the ways that we need to mop up additional money to expand the scope. But what we are trying to advocate as human rights advocates is that every Nigerian should be covered by the insurance.
Okay, great. And it's good you're part of the sector-wide approach. Yes. That's the State Advisory Working Group. So those recommendations, I'm sure it will be coming from your desk to the right authorities.
Yes.
But let's look at the role of state governments. Okay. We can't talk about universal health coverage, reaching out, having efficient and effective working primary health care centers without looking at community health development, and where would that be productive or effective it's from the state.
Yeah.
So what is the role of, you talked about 3 states pledging commitments, trust fund and all of that. Other areas, intervention. How would you assess states' interventions to bridge some of these challenges, with the gaps in the challenges we're talking about?
So more work needs to be done. It is always good to commend the effort of the governors.
Yes.
It is a difficult time, we all know. And health sector is part of the overall problems in Nigeria. It's not the only agency or the only sector that require money. So we commend them, but we need to encourage them to do more. That is the biggest challenge. The Nigeria Governors Forum, they need to organize the governors into a lot of conversation to commit more funding to the health sector. And the way that it can be done, like I said, is every state needs to establish the healthcare trust fund where you can pool money to deliver the service. Every state must have an efficient and functioning state insurance scheme where money can be mobilized from the civil servants, and also we need to establish the informal sector, as you already mentioned, that because there are a lot of, if you go to a state, maybe a state has 80,000 population of civil servant, in a state that has 6 million, 7 million people. That's a very small number. That means we need to expand the scope to bring in more funding through innovative financing mechanism, and also entrenching accountability and transparency to ensure effective utilization of available funds. So the mega money that is available, if we can do it very well, I'm optimistic we can achieve a lot.
Basi?
Okay, Doctor, we all know that the Renewed Hope agenda on health is to ensure that everybody has access to the kind of health care he or she requires,
yes,
irrespective of where he or she is, and ensuring that nobody is left behind.
Yes.
So so many initiatives have come up on the health sector.
Yes.
Let's look at RAMCA.
Yes.
What would you say about its impact on the people?
So,
And what is RAMCA first?
Okay, I happen to be part of that
Yes.
conversation, for the RAMCA, one plan, one report, one conversation, one budget. So that you promote coordination of multi-stakeholder and multi-sectoral approach.
And synergy.
And synergy. That's the whole idea. So the RAMCA is to look at the women health, the children health, and the adolescent health, including now the elderly. So we have added the E now, the elderly. So because many a time people neglect the elderly,
Yes.
and they have a lot of challenges also, of
A lot of health
retiree.
challenges,
And
a lot.
people hardly know. So we
Yes.
added the E now in the RMC plus N. So the elderly are added. So
Are you working with the Senior Citizen Center, the National Senior Citizens?
Yes, we are doing advocacy at
great.
that level. So the whole idea of this is show that women health, we crash the maternal mortality in Nigeria. So currently, if you look at the statistics, we have about 512 maternal mortality ratio, which it translates to about 33,000 women dying every year in Nigeria. That number is very high. The number is unacceptable. We need to crush the number. We need to reduce women dying during pregnancy, labor, and also after the childbirth. That is the whole essence of the RAMCA platform. It's a multi-stakeholder, multi-sectoral partnership coordination platform, bringing everybody to the table: the government, the professional bodies, the labor union, the civil society, the media, the young people, the private sector, the state government, including everybody to be on the table to have one plan. That is the sector-wide approach, one conversation, one budget, one report, and also, coordinating everybody to deliver. I think if we can, put all our differences, away and work as a team, we'll be able to achieve a lot in Nigeria.
You are part of the Champions for Partnership, Maternal, Newborn and Child Health.
Yes.
For WHO. You, of course, I'm sure you've played strategic role in all of that. If we want to look at, adapting international best practices and reduce this maternal mortality, child mortality, even malnourished what's the word now? She's the health expert. Malnourished children, the side effect of having malnourished children in society.
Yes.
How do we adopt, international best practices? What are some of the recommendations, get into communities where we get to see this menace, thrive even much higher?
Yes. So the international best practice is very simple. It's collaboration. It's called the Collaborative Advocacy Action Plan. That is the international best practice. It means whatever we should do in Nigeria, we should encourage collaboration. So the Minister of Health sit down with the commissioners, planning together. The commissioners sit down with local government, chairmen and primary health care coordinators, planning together. And not only planning, reviewing the progress together. Annual review, midterm review, coming together to look at what is going on and also learn the learning hubs, learning from each other. So this is the way to go. The international best practice is about convening people together to plan, to implement, to review, to monitor, and take remedial action. So
and not so long, actually, Dr. Garba, we saw the Ministry of Health, brought traditional rulers together, you remember, Bassi, to key into some of these government policies and initiatives because they are directly, with the people where we get to see most of these challenges happen. So that's the right step in the right direction.
That's it. So that means the traditional rulers, they are also not left behind. Religious leaders, they are also on the table. The community structures are there, world development committees, health sector, committees at the facility level, including the wheelbarrow pusher by the roadside, the lady selling, akara by the roadside, the teacher in the classroom, the media people in their own studio. Everybody is a stakeholder. Everybody is a stakeholder in the health sector. So everybody should feel comfortable to come to the table and say, I'm a stakeholder, I want to be involved, I want to know the value I'm bringing to the table to improve health sector in Nigeria.
Okay, Doctor, let's stand on that. Ruth mentioned malnourished children and I want a nutrition uptake. Now let's look at, recently the federal government came on with something, I think with partners, a shift to MMS, multiple mineral supplements, compared to the normal drugs they used to give to antenatal, to pregnant women during antenatal clinic. So, and most people don't know this.
Yes.
How would you educate our women out there? I think it's also in a bit to reduce the under 5 deaths.
That is true. So, I think the reason why the multiple mineral supplement are introduced is because of the challenge also. That for us to use our local food, local production is becoming a very challenging situation. The security situation in Nigeria is not helping matter. So this is one of the reasons why the MMS is was introduced, so that our own children that are malnourished, they could have a good supplement, they can eat very well, and they can also be able to survive infection and other challenges of feeding.
Okay, Dr. Garba, we're gradually winding down the conversation. Another challenge is the what WHO recommends, which is a challenge for Nigeria. They recommend a density of 4.45 of doctors, nurses, midwives, to 1,000 people.
Yes.
Now, we're seeing the whole migration of health workers happening because of the push factor and the pull factor.
Yes.
How can that be addressed? Because we're already faced with a deficit of the numbers.
Exactly.
And then we're having them being pulled out.
Yes.
How do we address that?
So one of the easy way to address the migration of medical doctors and also, of course, so many other health workers is to address the critical infrastructure. You mentioned earlier on about the infrastructure. So I think if we can fix the infrastructure,
that's the push factor now.
push within the country, I think we can go a long way to retain our health workers, including medical doctors, and also the welfare, the package. The health workers, when they see what,
which is the pull factor
the
now.
pull. So when they see what people, their own colleagues are in, outside the country,
Yes.
they find that maybe they're not able to earn 1/10 of that. So that's why there's a lot of appetite to move out. So as a government and as a people in Nigeria, we should fix both the push and the pull factor. But also we need to encourage patriotism. Again, so it's not only about the welfare and it's not only about the infrastructure. We need to also build the patriotic mind among every health worker. That is not enough for you to walk away because there's a problem. Stay in the country and let's fix the problem together. So this is to me also another way, but that could be done by encouragement, by mentoring, by coaching, by engaging the health workers and working with them to solve the problem. So many people this sometimes are not aware of the challenges of the policymakers or the political actors. So if we work together with the health worker and say, come to the facility, let's fix the problem together. There's no water, don't talk, come and let's fix it. There's no electricity, let's work together. I think this will encourage and address both the push and the pull factor to really reduce the migration of health workers outside the country.
Okay,
I
Basi,
think
you have a
most
final
times
question?
if you interact with the medics, their complaint most times is having a conducive environment to work with, not just coming in to fix this and fix that. I think it's just creating a conducive environment for them to work with.
Yes.
With the Minister of Health, the coordinating Minister of Health, continually talks about this and is working towards that. But I just want to ask, what is the role of the CSOs in, driving this renewed hope agenda of the federal government on health?
Yeah. So I think in summary, the role of the civil society group is to support the government to implement and also support the government to raise awareness and educate people, and also support the government where we can with the technical assistance and technical support. But while we are doing all these things, we also need to ensure mutual accountability. So we are supporting the minister,
And
we are supporting the
transparency.
system, so we need to keep encouraging them to deliver the renewal agenda with transparency and accountability. There should be zero tolerance, to lack of accountability in whatever we do. So we support the government, we encourage them, but they should deliver whatever they have in the government plan in an efficient manner so that the common man in Nigeria will find succor in all these problems in the country.
So very briefly, it's 1 year now.
Yes.
What are you picturing for the future in the health sector?
So I want to see the next 12 months, the minister and every policymaker related to the renewal agenda opening the space more, for civil society, for health professional bodies, for the young people, for the providers, and also the consumers. So there's a provider, there's also the consumer of the services.
Yeah.
I want to see them open the space more to continue to have conversation. To me, if we can do that, we can solve a lot of problems in Nigeria.
Well, as the giant of Africa, President Tinubu has been described as the African Union champion for human resources in the health sector. So let's hope and see what the renewed hope agenda, will bring for Nigerians 1 year going forward after 1 year. Let's keep hope alive. Hope is what keeps a man going. Thank you very much, Dr. Aminu Magashi Garba. He's a health expert and CEO and coordinator of the African Health Budget Network. Thank you so much. Thank you for the support to the federal government. Keep up the good work.
Thank you very much also. I
All right.
appreciate it.
Basi Ita Ipang, our health correspondent here in NTA, thank you so much for joining us on platform, and also Chairperson FCT Nawoj here. We're proud to have you. Thank you so much.
Thank you very much. But remember that your health is your sole responsibility. Keep safe.
Indeed. And we've been discussing assessing the health sector initiative under the Tinubu administration. Of course, good health is an embodiment of physical, social well-being of every individual. What are you doing to keep your health in check? That's Platform. I'm Ruth Aguela. Bye.
weekend deal.